Why You Can't Sleep Tonight, Menopause and Insomnia. Hello, I'm Dr. Ninth Tail. If you've been following this series, welcome back. We've talked about physical illnesses, stress, anxiety, depression, PTSD, obesity, and how our daily habits affect sleep. Today we're going to discuss another very common, but often misunderstood, cause of insomnia: menopause. This is especially important because millions of women struggle with poor sleep during this stage of life, yet many assume it's simply something they have to live with. The good news is that they don't. What is menopause? Before we talk about sleep, let's briefly define menopause. Menopause is officially diagnosed when a woman has gone 12 consecutive months without a menstrual period. The years leading up to menopause are called perimenopause, when hormone levels begin fluctuating. During this transition, estrogen and progesterone don't decline in a smooth, predictable way. Instead, they rise and fall unpredictably. These hormonal changes affect many different parts of the brain, including the areas that regulate body temperature, mood, and sleep. Why does menopause cause insomnia? Many people assume menopause only causes hot flashes. Hot flashes are certainly common, but they're only part of the story. There are actually several reasons menopause affects sleep. Night sweats. This is probably the symptom most people recognize. During menopause, the brain's temperature control center becomes much more sensitive. Even very small changes in body temperature can trigger a sudden release of heat. You may suddenly wake up feeling intensely hot, drenched in sweat, throwing off the blankets, only to feel cold a few minutes later. These episodes can happen several times throughout the night. Even if you fall back asleep quickly, your brain has already been awakened. The result is fragmented sleep that leaves you feeling exhausted the next day. Hormonal changes affect the brain itself. Estrogen doesn't only affect the reproductive organs, it also affects chemicals in the brain involved in sleep. As estrogen declines, many women notice they fall asleep more slowly, wake up more often, and spend less time in deep restorative sleep. Progesterone also has mild calming and sleep-promoting effects. When progesterone decreases, some women become more sensitive to stress and find it harder to relax at bedtime. Mood changes. Many women experience increased anxiety or depression during the menopausal transition. As we've discussed in previous videos, both conditions can significantly interfere with sleep. Sometimes treating mood symptoms also improves insomnia. Other sleep disorders become more common. Menopause also increases the risk of other sleep problems. One important example is obstructive sleep apnea. As estrogen declines and body fat distribution changes, women become more likely to develop sleep apnea. Many women assume they're simply having menopause symptoms when they actually have untreated sleep apnea. If you snore loudly, stop breathing during sleep, wake up choking, or feel extremely sleepy during the day, it's worth talking with your healthcare provider. Joint pain and body aches. Many women notice increased joint stiffness and muscle aches during menopause. Pain makes it difficult to stay asleep, just as we discussed earlier in this series. What can you do? The good news is that menopause-related insomnia is treatable. Treatment depends on what's causing your sleep problems. If hot flashes wake you up several times a night, treating the hot flashes often improves sleep. For some women, menopausal hormone therapy can be very effective and may significantly reduce nighttime symptoms. Hormone therapy isn't appropriate for everyone, so it's important to discuss the risks and benefits with your healthcare provider. There are also effective non-hormonal treatments available. If you think you may have sleep apnea, Getting evaluated and treated can make a dramatic difference in both your sleep and your overall health. Final thoughts. Many women believe that sleeping poorly is simply part of getting older. It isn't. While menopause certainly changes your sleep, you don't have to accept chronic exhaustion as normal. Understanding what's happening is the first step toward finding the right treatment. And in many cases, once the underlying cause is addressed, sleep improves significantly. Thank you for watching. I'm Dr. Ninth Tail. Sleep well, and I'll see you in the next episode.